I'm going to tell you about a simple billing mistake that's costing surgical centers $500,000 or more in unpaid claims. It's not about prior authorizations. It's not about medical necessity denials. It's about something much more basic, something that happens on almost every single claim you submit. It's called revenue code errors. By the end of this video, you'll understand exactly what revenue codes are, why they matter so much, and most importantly, how to fix the mistakes keeping your money stuck in accounts receivable. I'll show you 3 surgical centers where they recovered hundreds of thousands of dollars by fixing this one problem. Here's what most surgical center administrators don't realize. Revenue code errors aren't just annoying technical mistakes. They're financial emergencies happening at your center right now. Let me give you numbers. Last year, an orthopedic surgery center doing 800 joint replacement procedures annually. Good volume, excellent surgeons, strong outcomes. When I looked at their accounts receivable, we found $420,000 in unpaid claims. Know what the problem was? One missing 4-digit code on every single claim. Or, take this GI endoscopy center. 300 colonoscopies per month, high patient satisfaction, but they had $600,000 sitting in AR over 60 days. The cause? Using revenue code 0500 instead of 0490, one wrong digit. A revenue code is a 3 or 4-digit number on your UB04 claim form. It tells the insurance company where a service was provided and what type of charge it is. Here's the key difference. CPT codes tell them what procedure was done. A hip replacement is CPT 27130. But the revenue code tells them where that hip replacement happened. For ambulatory surgery centers, the most important code is 0490 ambulatory surgical care. But you also need additional codes for implants, anesthesia, drugs, and supplies. Use the wrong code or forget to include the right one, your claim gets denied. Mistake number 1. Using the wrong primary revenue code. I see billers use revenue code 0500, outpatient services, instead of 0490, ambulatory surgical care. Both sound like they could apply to an ASC, right? But insurance companies are specific. Medicare, Blue Cross, United Healthcare, they all require 0490. If you use 0500, your claim gets denied immediately with denial code CO16. That denial doesn't come back for 30 to 45 days, so the claim sits. Then gets denied. Then gets corrected and resubmitted. Then you wait another 30 days. You've just added 60 to 75 days to your revenue cycle. For one wrong digit. That GI endoscopy center I mentioned? 300 colonoscopies per month with revenue code 0500, every single one getting denied. By the time I got involved, they had $600,000 in AR over 60 days, and 70% was just this one error. We did 3 things: identified every claim with wrong codes, corrected them all to 0490, resubmitted with documentation. Result? We recovered $480,000 in 90 days. Mistake number 2. Missing required revenue codes for high-value items. This is the implant problem killing orthopedic and spine surgery centers. When you do a procedure with expensive implants, you need 2 revenue codes on the claim. Correct billing. Line 1, revenue 0490, facility fee, $8,000. Line 2, revenue 0278, hip implant, $15,000. Line 3, revenue 0370, anesthesia, $2,000, total, $25,000. But what I see constantly: incorrect billing. Line 1, revenue 0490, total charges $25,000, everything lumped together, one line. You know what happens? Insurance pays the facility fee, maybe $8,000, and denies the rest. They say the implant is bundled, but it's not. It should be billed separately with revenue code 0278. Once that claim is denied, it goes into appeals. Appeals take 60 to 90 days minimum, and if you don't have the right documentation, you might never collect on that $15,000 implant. That orthopedic center I mentioned? 800 joint replacements per year, 420,000 in unpaid implant charges, every single one missing revenue code 0278. We identified every claim, added revenue code 0278 on separate lines, attached manufacturer documentation, and resubmitted. Recovered $387,000 in 90 days. Just by adding one 4-digit code. Mistake number 3. Using revenue codes that don't match the CPT code. This is a logic error. Revenue codes and CPT codes need to make sense together. If they don't, the system flags it and denies the claim. Example: you bill CPT 27130 total hip replacement, but your biller puts revenue code 0510 clinic visit. Those don't match. A hip replacement doesn't happen in a clinic. Claim denied. The problem is, every payer has slightly different preferences. Blue Cross in Maryland might want one thing, United Healthcare wants another. Aetna has their own rules. If your billing team doesn't know these nuances, claims get denied. I worked with a multi-specialty ASC billing, 6 different procedure types: ophthalmology, orthopedics, GI, pain management, ENT, urology. They had one biller using the same revenue code template for everything. Same codes for every specialty, just copying and pasting. Result: 35% denial rate. Industry average is 20 to 25. They were 10 points higher just because of revenue code mismatches. We created what I call a payer-specific revenue code matrix, a cheat sheet that says, for Blue Cross hip replacement, use these exact codes. For United Healthcare colonoscopy, use these codes. We trained every biller on it, updated it quarterly. Denial rate dropped to 18% in 60 days. We recovered $300,000 just by matching the revenue codes correctly. Let me explain why these mistakes turn into $500,000 or more. It's what I call the cascade effect. Month 1. Your billing team submits 100 claims, 30 have revenue code errors, 30% denial rate. 30 claims times 8,000 equals 240,000 in AR. But here's what happens. Your team is busy submitting this month's new claims. Last month's denials? Those sit. Maybe next week, maybe next month. Month 2. Another 100 claims, another 30 denials. Now you have 60 claims in AR, 480,000. Month 3. Another 100 claims, another 30 denials. But now month 1's denials are in the 90-day bucket. Once a claim hits 90 days, your collection rate drops dramatically. Claims over 90 days have less than 25% collection rate, so of that original 240,000 from month 1, you're probably only collecting 60,000. You just lost 180,000. Fast forward 6 months. You've got 500,000 to 800,000 in AR over 60 days. 40% probably uncollectible because you're past timely filing limits. All because of preventable revenue code errors nobody caught. This is why revenue code errors aren't technical annoyances, they're financial emergencies. What's the solution? 3 action steps you can implement immediately. Step 1. Implement pre-submission claim scrubbing. Claim scrubbing software checks your claims before they go to insurance. It looks for revenue code and CPT code mismatches, missing required codes, incorrect bill types. Good scrubbing software can catch 40 to 50% of denials before they happen. Correo has a good scrubber. Advanced MD has one. Change Healthcare offers services. They cost $200 to $500 monthly. Now I know what you're thinking. That's an extra expense. But think about ROI. If that software prevents even 10 denials monthly, and each denial is worth $8,000, that's $80,000 in prevented AR. For a $300 investment, that's a 26,000% ROI. Step 2. Create a payer-specific revenue code matrix. Sit down with your billing team and create a document that says exactly which revenue codes to use for which procedures and payers. Example format: Blue Cross Maryland, hip replacement, primary 0490, implant 0278 with manufacturer invoice, anesthesia 0370, prior auth required. United Healthcare, same procedure. Primary 0490, implant bundled don't bill separately. Anesthesia 0370, prior auth over 10,000. See the difference? Blue Cross wants the implant separate. United bundles it. If you don't know that, you'll have denials no matter what. Build this matrix for your top 10 procedures and top 5 payers. Give it to every biller. Update quarterly. Step 3. Audit your current AR for revenue code errors. Pull up every claim over 60 days old. Look at the revenue codes. Are they correct? Are any missing? Do they match the CPT codes? Listen, revenue codes seem like boring technical details. I get it. Nobody opens a surgery center because they're excited about 4-digit billing codes. But here's reality. Revenue code errors are one of the fastest ways to accumulate massive accounts receivable, and they're also one of the easiest problems to fix. If your surgery center has more than 60 days of revenue in AR, I can almost guarantee revenue code errors are part of the problem. I'm Francisca, and I'm creating this channel to teach surgical center administrators exactly how to recover what you've already earned. New videos every week covering accounts receivable, denial management, payer strategies, automation tools. One last thing. Those case studies are illustrative examples based on industry patterns, but the systems and strategies, 100% real and proven. Your results will vary. Link in the description. Subscribe if you want to stop bleeding cash from preventable billing errors. I'm Francisca, and remember, you don't have a revenue problem, you have a systems problem, and systems can be fixed.